Thank you for giving me this time for you to hear my story. So basically, I'm just going to relay why I fight for Medicare for all. About 5 years ago, when my son was 17, he was hospitalized for suicidal thoughts and destructive behavior related to mood swings from a mood disorder. His caseworker informed my husband and I that our insurance, which was BlueCross BlueShield at the time, was going to run out, and that we would be financially responsible for his care if he was to stay in the hospital. This was determined even though the therapists and the mental health providers at the hospital felt he was not safe to come home. My husband and I were now faced with a dilemma. We cannot financially afford our out-of-pocket hospitalization, but we also needed to protect our son, who was not stable at the time, and our other children that were living at home. This decision should not have been in the hands of my son's healthcare providers. It should be in the hands of my son's healthcare providers and our outside therapists, who determined at the time that he was not safe, not in the hands of the insurance company. So we had a dilemma. We couldn't afford to keep him in the hospital, but he wasn't safe to come home. The caseworker at the hospital advised me to go to the Department of Children and Family and to open a voluntary case which allow him to access Mass Health. Getting him on Mass Health would ensure continued care for him and stabilize our home environment. Unfortunately, DCF was not opening voluntary cases at this time. The social worker at Department of Children and Family told me that the only option I had to get my son in the system would have to have him arrested. And this would trigger a DCF case and services for him. Just to be clear here, a Mass state social worker recommended that I had to have my son arrested so he would become a state charge and finally get health care. Our health insurance was denying him. So the day after my son was discharged, when he became out of control at home, instead of calling to have him evaluated and taken to the hospital, I called the police and I had him arrested. This was the only way that I could ensure long-term treatment. My son cried, begged, and pleaded for me to help him. He called me begging to drop the charges, to take him home. This was the hardest day of my life. Watching my son be taken away in a police car, knowing it was my doing, and then ignoring his pleas in order to get him help. The next day, the juvenile court ordered services and treatment that we could not obtain through our private health insurance. This came at a huge cost, not a financial cost, but just as debilitating. My husband and I lost the ability to determine the best environment and treatment for our son. He was placed in placements where he was abused, and the state of Massachusetts now had more control for my son's well-being than my husband and me. Worst of all, we gave up our rights as parents for mental health care. In a Medicare for all system, this would not have happened to my family. Care would have been determined by healthcare providers, not the insurance company, preventing families like mine from having to make such a drastic choice. I urge you to pass Medicare for all so no family can ever have to make the choice that we had to make. Because I can't tell you that this story is not uncommon. I can't tell you how many parents I know who have to go through the Department of Children and Family and put their children in state custody in order to obtain health care. It's just, my son's now 22 and I'm only now regaining a relationship because of what took place. And it's traumatic. Thank you for listening to my story. Sorry, I'm a little shaky and that's why I was reading, so it's hard to sometimes come through.
No worries. And Candace, I know Senator Friedman, members of the committee, and all here appreciate so much you sharing that story. I know personal is, but stories like that is what really impact us making these decisions. And so you having that courage today is really, it's meaningful for all of us. So thank you for doing that. And it helps us tremendously. So thank you.
You're welcome. Thank you.